So now we'll transition to our closing remarks, and I will retake control over the screen. All right, is that looking okay? All right, so for the last 15 minutes or so, we'll have closing remarks and next steps from Jaime Cabrera, Jade Woodard, and myself. And so the first will focus on next steps for funding and programs.
Thanks, Susan. Thank you, everyone. What an amazing day. I learned so much, and still I'm so impressed by all the work that's happening. So keep it up. Like I mentioned before, we will continue to look for new funding partners and funding sources, and really continue to partner with many of the folks that you saw presentations from today or that you've heard from to continue to dedicate resources and funds and time to this work, because it is so important and so critical. So thank you very much, and I will pass it back to Jade.
All right, well, thank you, everyone. It has been a fabulous day. We've really enjoyed all of the learning and conversation. Really look forward to continuing to partner and work together to everything that Jaime just mentioned and that we've heard all day. And please know that we invite you to join any of our work groups, our family advisory board. Please help us just continue to grow this work. And we are so thankful for you and so thankful for this partnership.
Thank you both. And I'll conclude with some next steps for the quick piece of CHoSEN, the Quality Improvement Collaborative piece. The first is that we are moving forward and beyond care of opioid-exposed newborns, recognizing that many birthing hospitals and families are impacted by other substances, such as methamphetamines, cocaine, marijuana, etc. And there's clearly a need to support families that are impacted by this as well. And so you will receive some additional information from our team about how our data system is changing a bit, how our toolkits may be altered somewhat to address the needs of families impacted by substance use, not just opiate use. You can imagine many of our work will remain the same, plans of safe care, prenatal engagement, engaging families during birth hospitalization. Those certainly are necessary regardless of the type of substance use, but perhaps things like eat, sleep, console, assessment of withdrawal, treatment of withdrawal when opiates are not involved may be something that you see down the line. So more to come on that. Certainly, as you've heard, prenatal engagement is a primary focus area of CHoSEN Quick over this next year with our pilot program, with our partners at CPCQC and their AIM OUD program, primarily focused on universal screening. We would like to expand our engagement with our MAT providers so that we can meet mothers and birthing individuals where they're at, as well as providing education to MAT providers who may not be familiar with the work that CHoSEN Quick has been doing. And then certainly transition homeward. You've heard a lot about plans of safe care today, but it would be truly wonderful if we had a model similar to Massachusetts, where it was a living document early in pregnancy that is easily accessible and that information transmittable across that perinatal spectrum. And I think even Massachusetts is struggling with how data is shared, but this would be the ideal, where there are seamless transitions such that birthing hospital providers are not solely responsible for having this plan of safe care in place at the time of infant discharge, where that hospital time is so short, from about 2 to 5 days. Engagement with outpatient providers is critical, and many of you on this call have heard me say many times, I'm not sure if shorter lengths of stay is necessarily a good thing. I think family engagement absolutely is essential, but having shorter lengths of stay is still unclear if we're shifting the burden to our outpatient providers and to our families during that discharge period. So we absolutely need to work more in the outpatient setting. And then supportive services for families in the first year of infancy. As you heard from Alicia Walkman's work, the rates of relapse are quite high in that first month postpartum. And how do we support families through that first year? We know that for mothers in Colorado, the leading cause of maternal mortality is overdose. from substances, particularly opioids. And it's not that it happens during pregnancy or just that first month postpartum, but in fact occurs almost equally across that first year postpartum. And so it's really important that we continue to develop and implement supportive services for families in that first year. And then I wanted to lastly highlight this report that was recently published entitled Prenatal Substance Use and Improving Family Health. And so this report came out of legislation that was passed in 2019 and then further bolstered in 2020. And this is the Perinatal Substance Use Data Linkage Project. Really, the goal of this legislative mandate was to better use data to inform public health and human service actions and improve outcomes for our perinatal population impacted by substance use. And so this is just the first part of this report that was published just last month. And you know, what's really notable is that this report highlights what are some of the factors that are associated with increased risk of infant removal from the home. So this analysis links birth certificate data with trials data, our child welfare data. And we found that inadequate prenatal care, lower household income, lower participation in WIC, and greater medical fragility of the newborn was actually associated with removal from the home. And so clearly, not only are these families high risk because of this history of substance use, but there's so much else happening. There's lack of prenatal care, lower socioeconomic status, as well as higher rates of preterm birth and NICU admission in these babies that were analyzed in this data set. And so I really encourage you to take a closer look at this report. And our hope truly is that we will obtain additional funding and support so that we can continue this analysis and bring in other data sets and other data sources so that we could really understand the broader universe and different levels that impact maternal and infant health. So as you can see here, this is just a representation of sort of a socio-ecological model, right? So we know that there are so many forces at the individual level, the community level, the hospital level, societal level, that impacts the health of families impacted by substance use. And so our hope is that with this part one, demonstrating some really notable results, that we will then have access and support for other data systems to understand the broader universe that our families are encountering, so that as we understand barriers and facilitators to accessing services and improving care, that we can then develop novel interventions or potentially improve the ones that are already in place so that they're more effective for our families. And so it truly has been a terrific day of meeting, learning, and collaborating. And so to end, we would love to hear back from you and ask, what's one thing you'll take away and or do differently from today? And so I'm going to stop sharing so that Cassie, again, will share that Mentimeter poll that she'll put in the chat and then share the results.
Great, thanks so much, Susan. I got the link put in there in the chat, and then let me pull up results as they start to come in and share them with everyone.
Great. And then as Cassie reminds us, if you can please also complete an evaluation providing us feedback about your experience during this forum, it would be incredibly helpful as we plan our future events. And to offer a bit of motivation, you will have an opportunity to be entered into a drawing for a $50 Amazon gift card for those of you that complete the survey. All right, I see some answers coming in. So the one action y'all plan to take as a result of your experience, the more engaging representation of data, listening to our families, applying the data to be more informative with parents and families I work with, improve breastfeeding guidelines, facilitate prenatal education, champion education about substance use with MAT providers. We need to get back to work and finish some started projects that were delayed during COVID. Mindfulness regarding how I speak to families impacted by substance use to avoid judgment. Share patient family stories with legislatures to help facilitate implementation of laws to help these families.
Thanks so much, everyone, for sharing your reflections. Don't hesitate to continue adding them. We certainly love to look at them later, but I'll hand the screen sharing back over to Susan.
Yeah, great. And so from that feedback, it looks like there's sort of renewed energy, certainly a renewed focus on engaging with families, having conversations with families, and really having families be a critical part of teams to inform the projects that we develop. All right, so thank you everyone for your participation, for your physical, emotional, mental bandwidth to really collaborate with us to improve the care of families impacted by substance use. Here on this slide is where you can go to find a lot more information, and certainly you can reach out to me directly. I will chat in my email address if there's any questions or concerns or additional information that you would like to seek. And then importantly, if there's something during the day that really struck you and you think, gosh, I want to be part of that, there's got to be a way that I can contribute my skill set or my interest to that effort. Please, please don't hesitate to reach out. So thank you all so much, and I hope you have a wonderful rest of afternoon. Stay safe.